Arterial blood gases or the ABGs. Arterial blood gases comprises of the three entities. Why we call it blood gases? Because there are three entities which are important in the ABGs. Partial pressure of carbon dioxide and partial pressure of oxygen and bicarbonate. ABGs is performed after the Allen test. Allen test is a very important and specific test which is physically performed on the patient's hand in order to know the patency of the collaterals, both the ulnar and the radial one. Because if we perform ABGs which are preferably performed from the radial artery, which is just overlying the radial bone, and if there is a thrombus formation in the radial artery, then ulnar should be providing the collaterals to that part of the hand which was being supplied by the radial artery. So Allen test is a way of knowing the patency of the both radial and the ulnar arteries. There are three entities which are important in the ABGs. One is partial pressure of carbon dioxide. Now, the partial pressure of carbon dioxide is related. Carbon dioxide is related with the lungs. It is generated by the tissues as a result of the metabolism, and body gets rid of it through the lungs. Oxygen is what the body gets from the environment, and through the lungs it enters into the body and is used for the metabolic requirement of the body, like the glucose, fats and protein when they are oxidized. Bicarbonate is something which either is produced in the body or can also be taken from outside the body, and kidneys deal with the bicarbonate. They either retain it or they excrete it out of the body. So, PCO2, partial pressure of carbon dioxide in terms of millimeter of mercury, is related with the functionality of the lungs, especially the bronchioles and bronchi, all these respiratory system. And bicarbonate is related more with the kidney, and the situations where PCO2 or PaCO2, partial pressure of arterial carbon dioxide, is either decreased or increased, we call it the respiratory. And those situations where bicarbonate is changed in either direction is known as the metabolic. So it can either be respiratory or the metabolic. So whenever we read ABGs, there are four components in the interpretation or in understanding of the ABGs: pH, PaCO2, bicarbonate, and PaO2. pH, partial pressure of carbon dioxide, bicarbonate, and partial pressure of oxygen. Partial pressures are taken in millimeter of the mercury, and bicarbonate is taken in milli equivalent per liter. Now, if we talk about the first component of the ABGs, it is pH. What is pH? pH is the inverse log of the hydrogen ion. Because other than the laboratory or the research status, we cannot actually directly measure the concentration of the hydrogen ion in the body, which is around 40. So there is an indirect way of knowing about the hydrogen ion concentration in the body. Hydrogen ion is directly related with the acidity of the body, or acidosis, what we call the acidosis or acidotic states. pH is inverse log of hydrogen ion. When hydrogen ion increases in the body, then the pH would come down. And if hydrogen ion decreases in the body, then pH would increase. So increase or decrease in the pH tells us about the opposite directional move of the hydrogen ion. For example, if a person takes HCl, but our hydrogen ion is not secreted by the kidneys, then pH of the body would decrease, and we will call it a condition of acidosis. But if somehow hydrogen ion is removed from the body, for example, if someone is having vomiting and hydrogen ion from the stomach is thrown out of the body, our kidneys are excreting a lot of hydrogen ion. In both of these situations, the pH would go high, and we call this condition uh, alkalosis. The normal value of the pH is 7.35 to 7.45. If pH is less than 7.35 in the body, or ABGs we call it, uh, acidosis. If pH is more than 7.45 in the body, we call it alkalosis. The presence of hydrogen ion in the blood is known as acidemia, and the lower concentration of hydrogen ion in the blood is known as alkalemia. But the condition wherein pH is less than 7.35 is known as acidosis, and condition where pH is more than 7.45 is known as alkalosis. For example, in a vomiting patient, there are chances of having pH more than 7.45, but in a condition where the kidney has got a problem and it's not able to excrete or secrete hydrogen ion from the body, then pH would be less than 7.35 because hydrogen would be on the higher side. The second component which is important in the ABG interpretation is partial pressure of carbon dioxide. Carbon dioxide is produced in the tissues or in the body, and the lungs get rid of this carbon dioxide. And when we talk about the carbon dioxide or its partial pressure, the most important thing, even in the lungs, are the bronchioles, bronchi, and trachea, the respiratory tract of the body. The normal value of the partial pressure of carbon dioxide is 35 to 45 millimeter of mercury, and every condition which is related with either the increase or the decrease in the partial pressure of carbon dioxide would be called respiratory. Whenever in the blood, partial pressure of arterial carbon dioxide is more than 45 millimeter of mercury, we call it acidosis, and because it is related with carbon dioxide, we call it respiratory acidosis. And whenever partial pressure of carbon dioxide or partial pressure of arterial carbon dioxide is less than 35 millimeter of mercury, we call it alkalosis. So one very important component of the ABG is the partial pressure of carbon dioxide. The second component of the ABG, or the third one, because after pH it was PCO2, now it is bicarbonate, HCO3. The third component which is important in order to have a basic understanding of the ABGs is bicarbonate. Bicarbonate is related with one major organ in the body, which is kidney, and all those conditions which are somehow related with the bicarbonate are known as the metabolic. Bicarbonate is either generated in the body or is taken from outside of the body. Uh, when the normal value of the bicarbonate is 22 to 26 milliequivalent per liter. When the bicarbonate level goes less than 22 milliequivalent per liter, it is known as acidosis. And when a bicarbonate level is more than 26 milliequivalent per liter, we call it alkalosis. And all those conditions which are related with the increase or decrease in the bicarbonate are known as metabolic. Now, if we compare partial pressure of carbon dioxide increase or decrease, and partial pressure of concentration of the bicarbonate increase or decrease, we see that the names given to their conditions are exactly opposite to each other. For example, if partial pressure of carbon dioxide goes higher than 45 millimeter of mercury, we call it acidosis. But in terms of the bicarbonate, its concentration, if it drops less than the lower normal, like 22 is the lower normal range, if it goes less than this value, we call it acidosis. And in when its value goes higher than the upper normal limit, we call it alkalosis. But in terms of carbon dioxide, it is exactly opposite. If carbon dioxide drops less than the lower normal limit, we call it alkalosis. So this is sort of a way of knowing that acidosis and alkalosis, they move in different direction to get the same name of acidosis or alkalosis. Some people call it rome. Some people call it the Rome. Rome mean respiratory opposite and metabolic equal. What do we mean actually respiratory opposite? Respiratory opposite means that when the pH drops less than 7.35, we call it acidosis. But when PCO2 drops less than 35, we call it alkalosis. So the respiratory limb is moving in an opposite direction of the pH. pH drops acidosis, PCO2 drops alkalosis. But when you look at the metabolic limb, it is sort of behaving the same direction. Like when the pH drops, it causes acidosis. But when the bicarbonate drops, it also causes the acidosis. When the pH is more than 7.45, we call it alkalosis. And when the bicarbonate is more than 26, we call alkalosis. So they are moving in the same direction, causing the same effect. So some people they remember this mnemonic: respiratory opposite and metabolic equal, in order to know the effect of these two components on the pH of the ABGs. Now, the last component which is important in interpretation of the ABGs is the partial pressure of oxygen. This is related with another one very important organ in the body known as the lungs. So, we take oxygen from the environment, and this oxygen goes all the way through the respiratory tract to the lungs and crosses the parenchyma, enters into the blood, generates a normal value of more than 65 millimeter of mercury, or 65 to 100 millimeter of mercury should be the normal range of the partial pressure of carbon dioxide. If there is less than, if partial pressure of oxygen, arterial oxygen, if partial pressure of arterial oxygen is less than 65 millimeter of the mercury, then it is known as the type 1 respiratory failure, which happens in cases of pneumonia, ARDS, heart failures. What is type 2 respiratory failure? When the partial pressure of arterial carbon dioxide is more than 60 or 55 or 65 millimeter of mercury. There are variability in the ranges in different books, and different people talk differently, but better to remember it around like 60 to 65 millimeter of mercury. When the partial pressure of carbon dioxide goes higher than 65 millimeter of mercury, we call it type 2 respiratory failure, which happens in COPD, asthma, bronchoconstriction, any allergic bronchospasm. But type 1 respiratory failure is when the partial pressure of oxygen is less than 65 millimeter of mercury. So now, after knowing a little bit about the certain basic components of the ABG, we need to know the how to interpret ABGs. ABGs are interpreted in a very simple way. First of all, you should know the name of the pH. In any ABG interpretation, always make it a rule of the thumb, always look for the name of the pH. What does the pH tells you? What I am? Like, pH is speaking its gender to you, whether I'm a male or a female. pH can tell you three important things: I am a normal range, I am acidosis, I am alkalosis. For example, if the pH is within the range of 7.35 to 7.45, it is a normal range pH. If the pH is less than 7.35, the is telling you the gender of the gases or the blood, and is telling you that my name is acidosis. And if pH is more than 7.45, it is telling you the name of the ABGs or the blood condition: I am alkalosis. So whenever you are to interpret ABGs, first of all, try to look what is the name of the pH. It is, you can have an analogy of like having the gender of a baby, whether this is a male or a female. Because once you know the gender of the baby, then and you are giving two options, male and female names, then obviously you will name the baby according to the gender. So let me explain it a little bit more. The pH of the ABGs would tell you whether this is acidosis or alkalosis. So whenever you are having a look at anybody's pH, first of all look at what is the pH is giving you the name. pH would tell you, if it is less than 7.35, it would be acidosis. If it is more than 7.45, it would be alkalosis. Then you can look at the partial pressure of carbon dioxide and bicarbonate level or concentration in the ABGs. You can look at them like in any order. You can first look at the bicarb, or you can look at the partial pressure of carbon dioxide. They would simply tell you whether these are acidosis or alkalosis. For example, if the partial pressure of carbon dioxide is less than 35, you would call it a acidosis. And if it is more than 45, sorry, if it is less than 35, you will call it alkalosis. If it is more than 45 millimeter of mercury, you will call it acidosis. And when you will look at the bicarbonate concentration, it can be less than 22, which is acidosis, or more, it can be more than 26, which is alkalosis. So first you will name the pH, then you will name both a partial pressure of carbon dioxide and bicarbonate. And whatever name goes with the gender of the pH would be the basic problem of the ABGs, basic problem of the blood, basic problem in the body. For example, if any person's ABGs are telling us that pH is 7.28, we know this is acidosis. We will write on this paper, on any paper, or we will keep this in our mind that the gender of the ABGs through the pH is acidosis. Now you will look at partial pressure of carbon dioxide and bicarbonate concentration. For example, if the partial pressure of carbon dioxide is 65, again this is acidosis, and the bicarbonate is either say 23 or 28, then it can be normal or or alkalosis. So of the two, which goes with the pH? pH was acidosis, CO2 is also acidosis. So the primary problem is respiratory acidosis. In ABGs, what interesting thing happens that when one component is causing the problem in the pH, the other component would try to move in opposite direction to negate that change in the pH. For example, if body is retaining carbon dioxide, partial pressure of carbon dioxide is going more than 45, then it would be affecting pH of the body in a way that pH would be dropping less than 7.35. How? This is a bidirectional equation. When the carbon dioxide goes high in the body, the direction of the equation actually goes leftward side, and at the end of that equation hydrogen ion increases in the body. Because we cannot measure hydrogen ion directly, then our pH would drop. When the CO2 goes high, pH drops. We call it respiratory acidosis. So the pH tells us the name of the condition, and partial pressure of carbon dioxide and bicarbonate concentration will tell us which one of these two is causing this problem through this equation. So whenever there is a higher carbon dioxide concentration in a body, it is going more than 45, it would be generating more and more hydrogen ion, which would be decreasing pH, because pH is the inverse log of hydrogen ion. So in any interpretation of the ECG, the first thing to know, ABGs, is the first thing is to know about the name of the pH, what the pH is telling you, then knowing the names of both the PCO2 and bicarbonate, and whatever goes with the name of the pH is the basic problem in the body. The other component would be moving in a way that it would be decreasing, lessening, or negating the effect of the primary component on the pH. For example, if CO2 is going high, it causing the pH to drop less than 7.35, then kidneys would start retaining the bicarbonate, because we know when bicarbonate goes high, it causes alkalosis. When bicarbonate go high, it causes an increase in the pH, which is decreasing as an effect of higher CO2. So body would start retaining the bicarbonate to negate the effect of the higher carbon dioxide on the pH. So these two limbs are working in a seesaw manner. So the first of all, you need to know what is the pH telling you, then to look at PCO2 and bicarbonate. That would give you the primary problem and the secondary compensation of the ABGs. For example, if you look at this ABGs, this is an interesting one. For example, if we look at the pH is 7.533. What it tells you? It tells you that I am alkalosis. Now pH is telling you that my name is alkalosis. Now you are to look downward on the partial pressure of carbon dioxide and bicarbonate, and see what is their name. PCO2 is 36.2, and we know the normal range is 35 to 45, so it falls within the normal range. So it cannot be the reason of pH going on the higher side. It cannot be the reason of pH making the body alkalotic. Now, when we look at the bicarbonate is 30.5. We know the normal value of 22 to 26 milliequivalent per liter or millimole per liter. So this falls in the category of alkalosis. Now, this is a very interesting thing. Now, if we look ABGs of this patient very keenly, we see that the pH is in the range of alkalosis. Partial pressure of carbon dioxide is normal, and the bicarbonate is 30.5, which is again alkalosis. So, of the two, normal and alkalosis, which goes with the pH, which is more uh, look alike of the pH, which is more similar to the pH. Obviously, bicarbonate, because bicarbonate is causing the alkalosis and pH is also alkalosis. So, the primary problem in this ABGs is metabolic alkalosis, and PCO2 has not yet started compensating it. So, when the PCO2 would start going higher than 40 or 45, the pH would start dropping down, because if one limb of the ABGs is causing the problem, the other limb moves in a direction or a different direction that it either lessens or negates altogether the effect of the primary problem. So these two limbs would be fighting with each other in order to keep or bring the pH within the normal range of 7.35 to 7.45, because if pH drops less than 6.9, we cannot live. If pH goes more than 7.8, we cannot live. Our life depends, our very survival depends upon the normal range of the pH. We cannot drink acid, we cannot drink alkali, because it's not compatible with life. Now, if we look at the last thing in this ABGs, it is partial pressure of oxygen, and this is 140 millimeter of mercury. The normal range is more than 65, and normal should be more than 65 or 65 to 100 millimeter of mercury. So, if some patients has got a PO2 of 140 millimeter of mercury, that simply means one thing, that we are giving more oxygen than the required one. So, we need to decrease oxygen. So I hope it makes a little bit sense of something. You can say in 100, from the 100, it gives you 1% of ABG understanding, and I hope it will be helpful for some people.